Hi, everyone. I'm Chelsea Anderson, a speech language pathologist and one of the founders of the Auditory Processing Clinic in Oklahoma City and Tulsa, Oklahoma. Today, we'll keep this simple and practical. Hopefully, you're going to leave with a better grasp of what's happening neurologically and why it matters for language and learning. We're also going to talk about what first steps you can take to support a struggling listener. Auditory processing happens in the brain, not the ear. APD isn't about hearing loss. It's about how the brain interprets and organizes what it hears. That's why kids with APD often pass hearing tests, but they still seem like they're not listening. If you're a teacher or a parent, you've probably seen this. The child who seems bright but struggles when instructions are given aloud, or the one in the group who looks lost during group lessons but then shines when shown something visually or worked with independently. APD is a lot more common than many people think. Roughly 1 in 20 children. And if you consider populations who are more prone to speech and language delays, it's likely going to be higher. More like 25% of those children will have auditory processing deficits. It often coexists with reading and language or attention challenges, so understanding auditory processing disorder is really important for teachers, clinicians, and families alike. To understand auditory processing disorder, you have to understand that we don't actually listen with our ears. We listen with our brain, and our ears are really just doorways so that sound could get in. But sound has to be used and processed by different centers in our brain to make sense. Whenever we're describing this to parents and patients alike, we want to put it in terms that are easy to understand, but also easy to describe to other people so they can tell people what they need and advocate for themselves. Sometimes we talk about auditory processing disorder as a software issue. Their ears are the hardware, and the auditory processing is the software. It's like having a nice computer, but if you don't have the right systems or software on that, it's just a hunk of metal. Another analogy is thinking about sound coming in as a really busy intersection, and there's lots of traffic and maybe even a standstill. So even though the sound is getting in, it doesn't know where to go. Okay, so I've had patients tell me before that listening with auditory processing disorder is like listening to an AM radio station. The signal is cutting in and out, and even whenever you do hear it, it can be really distorted with static, and any background noise makes the speech indiscernible. I've had that same patient go on and then describe that it's more than that, though, because you're also driving and you're trying to turn the volume up and you're trying to catch what you've missed, and you might be lost at the same time and you're navigating with your GPS, and everyone feels like they're angry at you. So, these are just some other ways of considering what auditory processing disorder might feel like, both for the listener, but also for those that we're advocating to. One of my first patients I had complete the auditory retraining program with me. He was a straight A student. He was just getting to the point in school where things were getting really hard, and he didn't understand why because he'd always done well before. But his system was being taxed more, and he had auditory processing disorder that was undiagnosed. One of the final incidents that occurred, that was the straw that broke the camel's back, was that his mom told me he had a comprehension assessment where they had to listen to an audiobook and they had to answer questions about the content of the story. And he got 2 out of 10 right. And he was trying, and he told his mom that he was paying attention and he was trying his hardest, and he still failed. And it felt really bad. But kind of on a positive note, toward the end of his time in the treatment program, he had only a couple of sessions left. His mom got We did our sessions on telehealth, and she got on the computer and said that they did another comprehension test that was similar to that first one that really showed her there was something going on, and that he was one of 2 kids in his class that got 10 out of 10. So, in our clinic, we use the Buffalo model approach to auditory training to assess and treat auditory processing differences and disorders. This approach really allows us to look at core components of auditory processing and create auditory processing profiles for these children. It allows us to be really specific in our treatment planning, and we are able to progress monitor more easily. The four core areas that we assess and treat as part of the Buffalo model include auditory decoding, tolerance fading memory, integration, and organization. When we're talking about auditory decoding, that's really our brain's ability to automatically recognize speech sounds in your native language. So that's what makes b and d, but b is not duh, not even close. Kids who struggle with auditory decoding are likely going to struggle with just understanding what's said to them in general, but it's going to become a huge problem when background noise is introduced. The literature really links auditory decoding skills with speech and noise perception outcomes. We also see a lot of these children struggle with downstream literacy acquisition. Reading's an auditory skill, and if it's difficult for these children to hear the differences in speech sounds, it's going to be even harder whenever they have to recognize the graphemes that are associated with those speech sounds. Another core area we work on is tolerance fading memory. This is a fancy way of talking about a child's ability to hold and store and manipulate and then use auditory information. The research really suggests that tolerance fading memory is a core component of speech noise processing, and people who have poor working memory for auditory information are going to struggle to hold the information they do hear in noisy backgrounds while they solve for what they missed. Working memory is also a huge predictor of new word learning and vocabulary acquisition. So children who struggle with their working memory are going to have a hard time learning new concepts, including words. We also target auditory integration, where we really focus on how a child is using input from either ear. So making sure that there is a balance between sides, but then also how they're able to integrate auditory and visual information or other sensory inputs as they are processing auditory scenes. Kids who struggle with integration are more likely to struggle with reading and in their academic pursuits. We also work a lot in auditory organization or being able to sequence what you're hearing. This can show up in following multiple step commands, but it can also show up in reading. It can show up in word finding. A lot of children who struggle with finding words to use in real time in conversation might struggle with auditory organization. They don't have a clear pathway to retrieve those words. So when I'm talking with families, I often describe it like this. Whenever you are having a conversation and you need to reference certain vocabulary, a lot of people with normal organization retreat into their brain and they go to the correct filing cabinet for those words and they're able to flip through and find the word that they're looking for. But if you have poor organization, you have less of a filing cabinet and more of a backpack with a bunch of crumpled papers at the bottom, and you are shuffling through as quick as you can, and sometimes you find it and sometimes you don't. But it's always exhausting. A question we often are asked is, can a child have APD if they also have ADHD or they have a language disorder? And really, yeah, they can. We contain multitudes, and honestly, a great proportion of our cases are going to have comorbidities or overlapping diagnoses. Um, you can see on this slide that we have a Venn diagram that shows some of these overlapping diagnoses, whether it's ADHD and autism or auditory processing disorder or dysgraphia. These different diagnoses share neural circuitry. So if we see deficits in one, it is likely that we're going to see some differences in another. So what we like to say is it doesn't matter if they struggle with listening and they struggle in functional context, then let's try to help them. And really understanding that a vast majority, probably 70% of children with auditory processing disorder are going to have some other comorbidity helps us gear our treatment and our intervention towards specific auditory processing profiles. So another core characteristic of auditory processing disorder that we see that comes through our clinic time and time again are difficulties with reading. whether it's difficulties just simply decoding CVC words and then blending sounds together to read out loud, or whether it's reading comprehension with fluent readers who are able to make their way through a passage but then don't have any recollection of what they've read. It's important to remember that reading is an auditory skill. And when the brain can't efficiently decode or organize sounds, it does affect reading and spelling downstream. So, whether they struggle with sounding out words or remembering spelling rules, reading difficulties in this population, as well as high rates of comorbid dyslexia. So, a question we often get in our clinic from parents, and we get this question from educators and other clinicians alike: why do these children often also struggle with reading and spelling? Um, and we always remind these parents and these clinicians and these educators that reading is an auditory skill. At least it begins that way. And so we have to be able to quickly, almost automatically, recognize the certain sounds that match certain written representations of those sounds. So if we're struggling to understand that b is b out loud, it's gonna be a struggle whenever we're doing it in our head and we're having to remember and blend and make sense of what we're decoding as we go. So a lot of these kids come through and they might struggle with reading or they might even be diagnosed with dyslexia. Some of the most recent statistics show that 50% of kids with auditory processing disorder are likely to have dyslexia as well. A lot of teachers and parents ask me what signs and symptoms to look out for if we are considering auditory processing disorder. We have a lot, we have lists of symptoms that you could ascribe to APD, but really a big thing is just listening, especially in background noise. You see these kids often become disoriented or confused or overstimulated when there's background noise, which happens in almost every setting, whether it's a classroom or the lunchroom or the home. Um, we see a lot of kids asking for repetition, saying huh or what, and sometimes they even start to respond as we're repeating ourselves. So really they didn't mean what, they meant wait because they have delayed processing time. We see a lot of academic struggles, like I mentioned before, difficulties with reading, difficulties with certain math concepts, and difficulties following multiple step directions, whether it's at school or at home or anywhere else. Um, but these kids, they're often called inattentive, or it's assumed that they're being lazy, but they're not. They're actually overwhelmed. When the brain is constantly working overtime to process sound, it leaves fewer resources cognitively for comprehension, memory, and participation in learning and social activities. So, what can we do to help with auditory processing challenges in the meantime? Number one is going to be reducing background noise. Background noise is speech comprehension's kryptonite. It is always going to make it harder, even for neurotypical listeners. And if you have auditory processing disorder, background noise feels like an insurmountable barrier. So, anything you can do to reduce background noise is going to automatically help this child with their listening. It's also really important to use multimodal learning, whether it's using visual and auditory or visual and kinesthetic cues with auditory cues. Addressing and assessing and giving multiple inputs can really help with comprehension. So, using visuals can be very helpful, whether it's a visual schedule or giving visual representations of instructions provided in class. Pausing between instructions and making sure that you're chunking information so that you're not inundating them or overwhelming them with multiple steps at once that they can't remember or process in an effective way. And then it's always a good idea to check for comprehension, confirming what they did hear and filling any gaps that they might have missed. So, a lot of parents and clinicians and educators ask us how soon we can evaluate children for auditory processing disorder. And previously, it was thought that we should be waiting until children are about 7 years old to assess for listening difficulties. But what we're finding out is that we don't need to wait, and that we know earlier is better in terms of intervention for speech and language and reading and everything else. So we definitely want to be assessing and catching these things as soon as possible so we can address them before we see a lot of downstream effects as well on reading and phonological development and language skills. So we can assess as young as 3.5 in our clinic, and we try to get a good idea of a direction for an intervention plan, and we give families and clinicians pretty clear frameworks for how they can address some of these things as early as possible. At the Auditory Processing Clinic, our SLPs and our audiologists work together to assess and train and support each listener. We partner closely with schools and with families to make sure strategies carry over where they matter the most. We always are making sure to touch base with educators and parents to ensure that we're assessing and addressing functional breakdowns that they are seeing at home and in school as well. So, this is just the broad strokes of APD. We wanted to gear this intro to where it spoke to teachers and educators and other clinicians alike. But if you recognize this in your classrooms or in your caseload, we really want to equip you with more content where we dive into the specifics of the Buffalo model and we talk about classroom modifications and testing details and ways you can implement practice in your own therapy sessions with these children. Thank you for spending this time with me. Remember that auditory processing disorder doesn't define a child's potential, but we can understand how to unlock it. So, together, let's create classrooms and homes that truly help every listener learn.